everybody, it's Dr. Randy, Kalkstein Family Chiropractic. Today I have Jasmine in the office. We're going to shoot a quick treatment video. Jasmine's coming in for a car accident. So she's having some, chief complaint was whiplash, neck pain, headaches, pain coming down between her shoulder blades, like so her mid-back. And also you're getting some low back pain too, some tightness in her low back. She just got off work, she's on her feet a lot. So that's compounding the problem. So she's been coming in for about 6 weeks on our auto. We're seeing some good progress. So we're going to show you just how, an adjustment and some therapy we do on her low back. Quick leg check here. Slide down just a little bit for me. We're going to start with her low back. Her right hip's out a little bit. You can tell by her leg length. Right leg shorter, so her right SI joint's an extension. That's bringing her leg up. So we use drop table. Table lifts up, sort of kind of drops. Sounds really loud, but it's very comfortable for the patient, and it is really good for low back pain. A lot of low back pain is SI's pelvic unleveling or pelvic misalignment that people aren't getting checked. So if you're having low back or hip pain, it doesn't take that many visits to come in and get your low back work on. You just drop work and done. We'll see. We'll do some soft tissue work for her. And just that little bit of drop alone gets her legs to even out. Now her muscles are pretty tight down there from the accident, so that's why it's taking some repetition. Most likely her muscles are going to pull that back out, but as she comes in more and we get some more repetition, that should hold for her. So we're going to do just some light soft tissue work on her low back. Just a really comfortable trigger point therapy almost. We're just going to strip out some of the inflammation in her QL muscles. QL muscles are those big lumbar muscles we have in our low back that attach to our ilium and then up to the upper lumbar vertebrae. And they're implicated with all low back pain. So we kind of usually will get in with, just like I said, nice easy soft tissue work. Kind of hold some stretching here. Just do a little bit more for you, Jasmine. How was work today?
Long.
One of the other really nice tools we'll use for the low back is this flexion distraction table. And we just kind of hook her up there. You hang on to these armrests right here. That's perfect right there. And with this, we can really stretch her back into flexion. So I'll kind of hold and then stretch down. That really pulls apart those vertebrae and pulls them into flexion too. So it feels really good for facet syndrome or bad discs, SI sprain strain like she has. And then I can even rotate side to side. It's a really good low back treatment. Really good for low back pain, hip pain, leg pain. We'll just do a couple passes each way, and then we're going to work our way up, get her mid-back adjustment. You okay there?
Mm-hmm.
Just a nice, easy stretch. It's also good for hip mobility. Okay. That's sort of the low back portion of her treatment today. Take a nice deep breath in for me. Exhale, Jasmine, all the way out. Good. Very good. Go on your back for me. Her mid back's tight. Part of that's from the accident. She has a little more of a little more injury than normal from all that whiplash. Yeah, roll back on my hand. Good. Last one. So what we're doing there is, with the adjustment is, and like we explained to a lot of our new patients, your spine is essentially a series of joints. It's 33 separate joints from the base of your skull down to your tailbone. What I'm looking for when you come in the office is I'm assessing those joints on an intersegmental level. So certain joints are going to be restricted in relations to the ones above and below it. Certain joints will sort of be misaligned and restricted. When that happens, that's called joint dysfunction. That joint dysfunction will occur without symptoms. That's why people can come in to see me and you could almost be symptom free, which I'm not advocating, but you could be, and I could still find some joint dysfunction or misalignment in your spine. But when we find those areas where there's restriction, where there's misalignment, we use a very specific adjustment to restore motion and alignment to that vertebrae. That's how we get to the root cause of your problem. We're not just masking the symptom with a drug or surgery. We're getting to the root cause, which is that spinal joint dysfunction, those misaligned or restricted vertebrae in your spine. That allows the tissues in that area to heal. It's going to allow your soft tissue, the nerves, the disc to heal properly because it's going to be in good alignment. If it's misaligned, you're going to have uneven stress, uneven wear and tear. It's like a car that's out of alignment. One tire is going to wear down faster than the other. Same thing with your spine. If it's out of alignment, you're going to have one side of the soft tissue of the disc wear down at an accelerated rate. You okay? Am I talking too much? Just relax your shoulders. This is easy for me. Add a girl one more time this way. Good. Pick your knees up for me. Relax them. This is what's just a little y-axis or distraction for her neck. Pick your neck up for me. Relax it. Good. Sweet. Get nice and comfortable. Stay off the ears and the earrings and just give a nice, easy, gentle traction pull. Feels great because everybody's compressed. Everybody has their head down on a phone, on a computer. Do it, just everyday life. Our heads are forward, and down. So this pull back here, along with the adjustment, really helps restore that bad posture by stretching those joints in a distraction type pull. You okay there? So that neck adjustment with this traction is good for headaches, neck pain, pain that radiates into your arm. You okay there? Good. So that's the adjustment and traction portion of her visit. We'll probably do some more stretching here, but let me do your shoulders, or hips and shoulders, and then you're done. Hang on to that table right there on both sides. Again, just a nice easy pull on those legs there. Good. One more this way. Good. That's good. That's a good hip, knee, ankle adjustment. Come on up. Let's do your shoulders. Bring your feet over. Same thing with the neck. The shoulders get rounded a lot for a lot of people because we're always forward. So we do the shoulder adjustment to help get that glenohumeral joint back in where it should be. Let your shoulder drop. Good. Same thing here. Let your shoulder relax. Good. We can even adjust your wrists. Good. This side. Very good. Okay, that's our adjustment for today. Okay, we'll probably do some stretching, but that's just real basic stretching we'll do for hamstrings and hips here now. But that's the adjustment portion with some other traction things we do. So if you're having back, neck pain, headaches, anything like that, don't just take a drug for it. We'd love to see you in the office. Come in and get checked. We'd love to see you at 3 offices in Monroeville, North Huntington, and Irwin. Thanks. Bye.